to Urgent Care on Call. My name is Dr. John Essen, also known as Dr. E to many of you. I am a practicing emergency medicine physician, and by popular request, I'm here to discuss part 2 of strokes and everything you need to know about a stroke. Let's talk about the types. There are 3 main types of strokes. We talked about both ischemic and the hemorrhagic stroke in our part 1 discussion. And if you recall, ischemic stroke is the most common type of stroke and involves a blood clot that prevents blood and oxygen from reaching the brain. And hemorrhagic stroke occurs when a weakened blood vessel ruptures, and this normally occurs as a result of an aneurysm or an arterial venous malformation, commonly known as an AVM. Transient stroke, transient ischemic attack, we did not talk about. So TIAs, also referred to as mini stroke, occurs after blood vessels fail to reach parts of the brain. Normal blood flow resumes after a short amount of time and symptoms usually cease. TIAs should be regarded as a medical emergency, even if the blockage of the artery and its symptoms are temporary. They often serve as a warning sign for future strokes and indicate that there is partially blocked artery or clot source, usually in the heart. According to the Center for Disease Control, CDC, over a third of people who experience a TIA have a major stroke within a year if they have not received any treatment, and between 10 and 15% of people will have a major stroke within 3 months of having a TIA. Now that we have discussed the different types of strokes, what are the risk factors or causes of strokes? Remember, different types of strokes have different causes. However, strokes is more likely to affect people if they have the following risk factors that I'm going to mention. Top of the list, obviously, obesity, age 55 and older, family history, if you lead a sedentary or inactive lifestyle, alcohol, tobacco, illicit drug use are all part of this list. Since I had so many request symptoms for stroke, I think it is fair to say that stroke symptoms are varied and often appear without warning. However, one of the things that we need to commit to memory is the FAST acronym to help in identifying the onset of a stroke. The EARTH stands for facial drooping. This is seen in people that cannot smile or have a droop on the side of their face. A is for arm weakness, can't raise both arms and does have a drift in one arm. S is for speech difficulty. Difficulty in repeating phrases or slurred speech. T is time to call 911 or any form of emergency service. Remember, the faster a person's suspected stroke receives medical attention, the better their prognosis will be and less likely they will be to experience permanent damage or death. So, some of you also ask questions about diagnosis. All I can say about diagnosis is that you should remember that for a person experiencing a stroke to get the best diagnosis and treatment possible, they should be treated at a hospital within 3 hours of the symptoms appearing. This often includes, obviously, being examined by a physician, and some of the tests includes blood analysis, CAT scans, MRIs, carotid ultrasounds, and sometimes cerebral angiograms and even echocardiograms can be done. That said, this brings us to the end of our discussion about strokes. I hope you find it useful, and don't forget to leave comments or let us know about topics you would like us to discuss in the future. Also, don't forget to reach down and subscribe to our channel and become a subscriber. And if you would like to be notified about new videos, reach down also and click the little bell next to the subscribe button. And remember, for all your non-emergent needs, we can be found on our telemedicine platform, which is www.urgentcareoncall.com. And I'd like to say thank you for the thumbs up.